I welcome you all to the SANEM International Development Conference, SIDC 2020, on COVID-19 and development challenges. And this session is on economic and institutional challenges. From SANEM, we think that a conference like this will significantly contribute to the current discourse on COVID-19 and the kind of papers which we have received so far and the papers which are going to be presented. I think this will really contribute to this public discourse on COVID-19 and its impacts. I sincerely welcome and give my warm welcome to my sir and thank the chair of the session, Dr. Salim Jahan, who is the former director, Human Development Report Office, UNDP. Thank you, sir, for being with us. And your presence and your comments in this session, I'm quite sure will enrich our conference. 4 papers will be presented. I welcome all the presenters. Thank you so much for your contribution in this conference and also creating the public knowledge on COVID-19. I will be the discussant in this session, so I will talk after all the 4 presentations are over. I welcome all the participants from all over the world and thank you so much for joining us. You have been with us from yesterday and I know there are a few new participants too. And we'll have our final session day tomorrow and 3 sessions. So I hope that you will also be joining with us tomorrow as well. A few housekeeping announcements. The guidelines of the session have been shared with you all. The participants will write their comments, questions in the chat box. As due to the time constraint, we will not be able to allow any participant to speak in the session. The presenters will hear a notification from Mr. Mahatabuddin, who is a research fellow of SANEM, and also who is the timekeeper of this session, at 12th minute that only 2 minutes are left. And a final notification that your time is over at 14th minute. With this, I request Dr. Salim Jahan to take over and kindly conduct the session as the chair of this session. Over to you, sir. Sir, you have to unmute.
Yes. Thank you, Salim. Can you hear me?
Yes, we can hear you, sir. Thank you.
Thank you. First of all, warm welcome to all the participants and the presenters for this particular session. And I congratulate SANEM for organizing this international conference. We all know that our development process and the path would be very much influenced and would be guided and shaped by COVID-19, which is not only an issue of public health or a health issue, but it's a developmental issue. And I think SANEM has rightly chosen the topic of this particular session as economic and institutional challenges, because we all know that COVID-19 would definitely pose challenges for public health, for human development, but its economic issues and economic challenges are also quite substantive and substantial. And I think when we talk about the economic challenges, one part of the challenge is as the COVID-19 is spreading all over the world, there are economic consequences. There are consequences on income, on employment, on the survival standard of living, and the list goes on. But the other set of challenges will definitely emerge when the COVID-19 would be weakened, COVID-19 would be gone, and the economies and the lives of the people will have to be put back on the development path. So that kind of a transition would also pose a challenge in terms of job creation, in terms of income earning, growth, and so on and so forth. And one big question in this whole matrix is whether the institutions are ready for that. Can we deal with these challenges of tomorrow with the institutions of yesterday? And I think one big question there would be how we can reshape our institutions, whether new institutions would be needed, both at the national level as well as the global level. And I'm very glad that the 4 papers that would be presented in this session actually deals with some of those issues. I mean, one is on the mobility restrictions and what happens to that. The other one is the compliance issue. The third one is on the whole question of trade, corruption, and COVID-19. the evidence from Kenya. And the fourth one is the moral economy of the pandemic, the whole question of weak states and the role of the states. So they all have very diverse focus, but I'm pretty sure that they all talk about the kind of the economic and institutional challenges that we are facing now, and we will be facing in future when we have to get the transition from COVID to post-COVID situation. So with those remarks, I would now try to invite the paper presenters to present their paper. We have a total time of 1 hour. And since we have 4 papers, it basically means that each paper only has 15 minutes. So I would request the presenter to be brief, to refer to main points, to main conclusions, rather than go into nitty-gritties. This is for the sake of time, but also I think that makes the paper presentation interesting. The first paper is the Pandemic Catch-22, how effective are mobility restrictions in halting the spread of COVID-19 in developing countries. There are 2 authors for that. One is Adnan Fakir, who is the PhD candidate in economics, University of Western Australia. And the co-author is Dr. Tushar Bharati, who is the assistant professor of economics, University of Western Australia Business School. If I understand it correctly, it would be Adnan Fakir who is going to make the presentation. So you have the screen and you have 15 minutes. Thank you.
Thank you, sir. Let me share my screen quickly. Is the screen on? Okay. Okay. Can everyone see the screen?
Yes, it is. Thank you.
Thank you. Well, thank you for having me. It's really an honor to be here. Thank you, sir. As Dr. Salim Jahan mentioned, our paper deals with regarding the mobility restrictions, and we're curious in terms of figuring out how the COVID mobility restrictions interacted with various institutional factors and country demographics in terms of halting the spread of COVID-19. So the conversation is already out there, so I won't spend much time behind it. There has been a massive level of activity and mobility restrictions in response to the pandemic, and there have been arguments as to whether that response was too slow and insufficient or whether too extreme. So that conversation of too little or too much mainly hinges on the effectiveness on these measures. And there are past papers that have looked into small-scale restrictions and quarantines, and some of them were successful, some of them were not. So building on that, our central research question is how effective are activity and mobility restrictions at containing the contagion? Okay, and what factors contribute to their effectiveness? Now, of course, an analysis like this, and I'll jump straight to the point, has a major source of endogeneity. Restrictions or responses by the government put forward in a country are usually in response to the expected disease situation, not only the prevailing situation. That creates a source of endogeneity, and watchful populations can take early action as well. So there is the issue of identification in this paper, and the way we approach this identification problem is that governments, when deciding the level of stringency they're going to put forward in a country, looked at this situation not only at the home country, but also what they expected might happen in the future in the absence of strict measures. So they looked at what other countries were sort of trying to do. Okay, so now, of course, we don't have the perfect counterfactual. They don't know that. But in that cases, the expectation is based on the actions taken by the other countries. Okay, so and from newspaper articles, we know that if certain countries were enacting stronger measures, some countries were getting additional pressure to enact measures. That was at the beginning of the pandemic. Now the story has reversed, and that's a different conversation. But anyway, so the argument is that stringency in other countries on a particular date will be correlated with the stringency in my home country, but it will not affect the mobility in my home country or the growth rate of outbreak variables. Now, there are validity arguments, and if those questions come forward, I will definitely address them. Okay, so the empirical strategy is fairly straightforward. In the first stage, we are predicting the stringency measures in a particular country with the stringency measures in the other countries, and our preferred specification is to reduce is to exclude the countries in that particular sub-region. And we use World Bank's classifications for that. The reason we do that is because there are issues of migration, and at the same time, sub-regional countries can actually respond to other countries. So that's why this is our preferred one, but we do try it with other IVs as well. And we also look at several lagged effects. Okay, and the second stage, once we have the instrument predicted, is basically outcome variables. And the outcome variables are the different mobility measures. They come from Google data and some outbreak measures, which I'll explain in a bit. So the data comes from several sources, with basically 127 countries between the dates of 15th Feb to 30th July. And we get the stringency index basically from the Oxford Government Response Tracker, so OxCGRT. Now, the key to keep in mind is that this is basically what governments have been trying to enact. This does not imply compliance. So that's a different issue altogether. And our estimates will effectively pick up compliance as well, or lack of it. And then we get the mobility data from Google, which is basically high-level mobility data from 6 particular locations: groceries and pharmacies, retail and recreation sites, parks, transit stations, workplaces, and residences. And of course, the COVID outbreak data comes from Johns Hopkins and our World data for tests. Now, of course, there are data limitations in terms of the COVID-19 data. We all know that, the lack of reporting and all of that. Now, we do take some measures to sort of minimize that. Once again, I'll leave that for questions now. Before moving forward, here is sort of like an event association from the Oxford data. So day 0, that's on my x-axis, that's the number of days. So day 0 represents the date of the lockdown for each country. We have lockdown data for 107 countries, and these are all national. And the red line to the left of that, that's the first red line in each of the graphs, basically is the average date of recommended lockdown or anticipated lockdown. So in some countries, the government announced it earlier. In some countries, they recommended on a national level. And we see that from the day of the recommendation, the mobility, which is the blue line, that goes down and the stringency starts going up. And this is the case for almost all 4 of this. And there are 2 others which we don't show here, but the similar trends follow. The reason we show this is our instrument would not be valid if people in a home country responded to stringency measures in other countries as opposed to their own countries. So here we see that the blue line before the first red line, before it was announced, is fairly constant. It's not really reducing that much, but the reduction really starts from when the home country starts announcing the stringencies. So that's where we get the rapid fall. Okay, on to the results very quickly. So the first set of results is basically the stringency index on our mobility measures. So that's the first panel on top. And I'm showing only 2 of the outcome variables. One is contemporaneous, that's lag 0. Another one is with the 14 days lag. And we see that contemporaneous stringency actually affects my mobility the most, which is expected. However, when we move on to the outbreak variables, which is the case of tests, and I'm going to focus on cases on tests and deaths to tests because we believe those are better measures, a lagged stringency has a stronger effect. So the magnitude goes up. Okay. And just to be clear, the instrument is working. It's not weak. We get quite a high f-stat value as was expected. Okay, so that's the first set of results. So from here, the next question was that, okay, so what's happening is that stringency is having an effect. But what about the heterogeneous effect according to different factors in a particular country? So we look at multiple factors here. We look at population density, primary education, poverty headcount, Gini index, the proportion of the population age 65 and older, and the average PM 2.5 in the past 7 years. That's been accumulating. Okay, so these are some of the measures, and here I'm just showing a coefficient plot of above and below median according to this measure. So the way we would go about this is for the countries with the population density that is above median, the stringency effect, the marginal effect, is actually stronger. It's more negative compared to countries with the population density that is below the median. Okay, so the idea here is not to find statistical significance because, as you can see, the confidence interval is overlapping in majority of the indicators, but we want to see whether there is economic meaning and what the general trend is. So We repeat this for a plethora of indicators and for each of the mobility measures and as well as for all the outbreak variables. So I'll summarize the heterogeneous impacts here because that's way too many. So we see that restrictions tend to curb mobility better in developing countries, at least according to the Google data. Now, keeping in mind, Google data is not representative of the entire population, especially for developing countries. So basically, the stringencies tend to have a larger marginal effect for countries that are densely populated, poorer, more unequal, more polluted, younger but unhealthy populations, and those with worse health infrastructure. Now, this does not indicate compliance. I didn't show the summary statistics. Summary statistics show that compliance was in general lower in developing countries. So mobility did fall less, but this is simply the marginal effect of stringency. On the other hand, when we take the outbreak variables at our outcome variables, we see that restrictions contain the contagion better in relatively more developed countries. So countries that were richer, more equal, less polluted, older but healthier populations with better health infrastructure, and were more democratic with better government effectiveness. So then the question is, so that is basically what I was summarized here. The point is that stringency is working better at limiting mobility, at least in terms of marginal effect in less developed countries, but did not do a better job in terms of containing the contagion. And these results are in agreement with what Bernard Howell and Mushfiq Mubarak present in their paper as well, and something that Revallian provides an inclination towards. So in order to sort of like explore this further, the next thing we do is we estimate a 3-stage recursive conditional mixed process model. And the idea was to compare how changes in mobility due to stringency policy measures affected the growth rates of the contagion. So the idea is very simple. We again used IV to predict stringency in my home country and use that to see that how much it affects mobility, and finally use that predicted value to our growth rate measures. So these are the results from the recursive CMP model. And once again, it's fairly, the general story holds once again. We see that, and I'm showing only the results for cases to test ratios growth rates. And this is once again only for transit stations. There are all of those other mobility measures, but we get a similar result here. So again, countries with a lower population density, that's below the median, tend to have a stronger effect. And similarly, for education, for poverty headcount, countries with lower poverty headcount have a stronger effect, with the Gini index that are more equal have a stronger effect, and so on. Okay, so the results generally hold. Now, why is this happening? That's the next question. Now, before going to that, I should mention that the results are robust to the different IVs and limited samples. Okay. More importantly, I mentioned the limited sample here because one of the things that came forward is in terms of contact tracing. There's a paper by Angelopoulos who show that countries who conducted only contact tracing, they have more reliable COVID data. So when we limit our sample to that, we end up with the same results. And another problem of the instrument is that since the testing strategy within each country changed over time, our fixed effects and our instrument would not account for that. So we try to limit our sample, at least during the time period when the testing strategy was consistent. And we once again find similar results. So decrease in mobility due to stricter restrictions had a larger effect in controlling the contagion in developed countries. Okay, so what's happening? Why is it not as strong a marginal effect in developing countries? And some of the other papers allude to that. Flattening the curve is only marginally useful in the less developed countries in terms of health infrastructure being overwhelmed. And this is something that once again, Bernard Howell and Mubarak brings up. There's also lack of awareness in terms of best practices when quarantined and isolated. And the RCT by Banerjee and the others, where they conduct the information campaigns in India and find that those information campaigns actually result in better compliance and reporting, it's sort of like a cue to that. There is poor government effectiveness. In other words, there's sluggish enforcement of recommended best practices. Remember, our estimates do not differentiate between compliance and the effect of the stringency. So we're picking both up at the same time.
Dear presenter, you have 2 minutes left.
Thank you, Madhav Bhai. So higher population density means simply that higher rate of human-to-human contact, even with reduced mobility. they can become more immunocompromised because these people rely on daily wages. And when daily wages are not there because of stringency measures, few people can fight it off. And that's something that Chia et al. Alludes to. And finally, the stricter restrictions have definitely economic costs. And that economic cost can affect the immune system further. And finally, in conclusion, what can be done? What we conclude is that mobility restrictions alone are not sufficient in developing countries. They need to be complemented with awareness, economic, and health assistance schemes. What can be these policies? An example is the Banerjee paper, which I know that some people are also trying to implement in Bangladesh in the near future. The question is, how do we fund them? Because we have long-term global costs, we really need global cooperation in terms of addressing this. Thank you. That's it from me.
If you kindly could stop sharing. Yes, thank you. So Dr. Selim Jahan, sir.
Thank you. Thank you, Adnan, for brilliant presentation. I think it raised a number of issues which would be picked up in questions from the participants and your fellow presenters. The second paper is by Dr. Upasak Das, who is the Presidential Fellow, Development Economics, Global Development Institute, University of Manchester, UK. Dr. Prasenjit Sarkel, Associate Professor, Department of Economics, University of Kalyani, India. And Dr. Sani Ashraf, Research Scientist, Center for Social Norms and Behavior Dynamics, University of Pennsylvania, USA. The title of the paper is Lockdown, Community Evidence and Individual Compliance with COVID-19 Guidelines, Evidence from India. And I think Dr. Prasenjit Sarkel is going to present the paper. You have the screen, sir.
Prasenjit, you have to unmute your microphone. Prasenjit, you have to unmute your microphone.
So, am I audible?
Yes, now audible. So you can start from the beginning.
Yeah.
Thank you.
So thank you, SANEM, and thank you, Professor Raihan, and thank you, Professor Jahan, for giving me this opportunity to present our work. And of course, I would also thank Adnan because he kind of provided a perfect ideal launching pad for posing our paper, which is kind of continuation of the queries that he is kind of raising. So basically what we are trying to do in our paper is we are trying to see whether deterrence policies in terms of lockdown could actually go towards ensuring higher compliances and for COVID protocols in India. And we would be sort of presenting the preliminary findings from our online survey, which I'm going to describe very shortly afterwards, where we have gathered some evidence regarding this compliance across lockdown phases in India. So just a quick recap of the situations that we had been experiencing for COVID. And as you can see that the daily new confirmed cases are increasing over time. And as you can see that, say in terms of, in fact, new confirmed cases, India, United States, and Brazil is actually topping the list. And also in terms of daily new COVID cases, India and United States are the forerunners in the world. Now, so far, if you look at the government response to this kind of pandemic across the world, you will see it. So this is basically a kind of stringency index, which Adnan has actually talked about in detail, but we are going to show some bits of it. So the upper left-hand panel is actually showing the government response stringency index, and the deeper blue line are basically the countries that are actually having a very stringent measures in terms of public closures of schools, in terms of stopping of gatherings of people. And as you can see, that India is one of them. In fact, if you take separate categories of these stringencies, you will see that, for instance, cancellation of public events in the lower upper right-hand panel, and in terms of restrictions on public gathering, and in terms of restrictions on internal movement, in all these cases, you will see that India and America is actually being the forerunners in terms of such deterrence policies, or in terms of such stringent policies. So what is the context in which actually we are posing our work? So as we all know that in absence of currently, as so far as the current position goes, in absence of any medical therapies like vaccines, non-pharmaceutical interventions, NPI, are basically key to COVID protection. And NPI involves compliance with COVID norms like social distancing, wearing masks, and hand hygiene. But in order to infuse that, public policies mainly relied on deterrence measures like lockdown, as I said earlier. But eventually, as the economy opens up, there would be growing emphasis on voluntary compliance. It would entirely rely on the incentives that would promote such kind of compliance activities so far as the individuals are concerned. So what is actually the problem with voluntary compliance? So incremental expenses of compliance may be compensated by health gains. So the individuals might kind of convince himself that, okay, if I engage in kind of compliance activities, that is kind of costly, but yet I would be compensated because I'm going to gain my health. But yet, I mean, large amount of literatures, for example, in the vaccination fields or in fields of public good contribution, have actually shown that these kind of activities, which usually have a collective benefit but poses individual cost, in line with such kind of activities, compliance to this kind of COVID protocols would be inadequate. Why? Because contagion kind of poses an externality that may not be accounted for in the individual decision. So individual might think, okay, so he might not take into account that he is going to be one of the carriers given the high contagion rate for the other population in his immediate neighborhood. And so voluntary compliance might actually respond to community behavior. So he might kind of imitate. There's a large kind of literature in behavioral economics which says that individual might catch up on the behavior of the people who are residing in its immediate neighborhood. And so there's a need to blend public health aspect with the social context in which this compliance behavior is being talked about. So what about the Indian context? So if you look carefully, so we can be kind of be assured in terms of the total cases per million. So compared to USA and Brazil, we really have very low rates of cases. And also in terms of deaths also, where USA and Brazil have actually shown over 600 deaths. From here, we have actually the per million death is only 72. But the situation actually gets reversed when we look at the total amount of tests that we are doing in India, which per million, the figure is very, very low. And so coupled with low testing, we have widespread violation of COVID compliance that is getting reported in India. So the question that we are posing, do we need alternative incentives as opposed to deterrence? So can we really consider some other alternative incentive structure? So in this context, in this paper, what we would be exploring is to the extent that we have seen that moral motivation in terms of fostering self-image, in terms of altruistic motives, fosters some kind of voluntary contribution to public good, whether in the same line can we expect that individual mimics community behavior, and if the individual lives in a community where they could see the enforcement of positive norms, individuals could actually pick up those kind of good behaviors, and that could actually influence his compliance level or his compliance rate. So the basic question that we would be asking in this paper is, how effective is moral motivation relative to stringency or deterrence measure in ensuring private compliance for a systematic disease risk? So that is the basic question that we are asking. So what is our contribution? So our main contribution is fourfold. One, we model private compliance in a setting where we assume that individual health and community compliance have an interdependent relation. And compliance is actually determined by the interaction of foregone consumption, health effect and better self-image being. So this better self-image effect actually comes from the feeling that the individual wants to be like the community in which he resides. What we show that even after controlling for individual health and income, private compliance might move in the same direction with community compliance. So our paper actually underscores the community behavior as playing the pivotal role in guiding private compliance. And what do? We use online survey data from India across successive phases of lockdown and show that deterrence policies might actually dampen voluntary compliance efforts. So to the effect, we find that deterrence has a negative effect on voluntary effort, and we show that the community compliance can actually stimulate better compliance with the COVID protocol norms. So this is the conceptual framework that we have in mind. So a very simple framework. So we have a utility function where there's a health function of the individual, which is actually dependent on both the community compliance behavior, which is given by C bar, and individual compliance CI. And the self-image function is basically a very standard one, which is taken from Recursive. And if you see that the self-image function is basically a concave function of CI, and it achieves a global maximum when CI retains a value of C bar. And so if we solve this model from the first order condition, we will see what I had been talking about, that CI is actually a function of the opportunity or cost of consumption if the compliance activity is costly. It is also a function of the positive health effects which emanates from the consumption activities. And finally, it also depends on the community level behavior, that is C bar. Now, what follows is that in certain circumstances, it is entirely possible that if the positive health effects from compliance actually compensates the individual fully for the foregone opportunity cost of consumption, then the entire private compliance behavior will be motivated by C bar. So if the first and the third term actually cancels out, then CI could actually be entirely dependent on C bar. And in the event that the first term is the opportunity lost from consumption is higher than the health gains, then CI would fall, and it would fall below the community level of behavior. So from taking cue from this, we actually estimate this private compliance behavior using the online survey data. And this is basically the survey that we actually conducted. So we had a sample of 934 respondents across India from April 27 to May 31, and we did mainly snowball sampling. We administered in 4 main languages: Bengali, Hindi, English, and Tamil. Majority of the respondents were from West Bengal and Tamil Nadu and parts of Hindi-speaking belt, but we actually controlled for that in our estimation. And this study was actually approved by the Institutional Review Board of the University of Pennsylvania. So what are the main variables that we would be exploring? We would be exploring measures of individual compliance, which is elicited in terms of individual response to the degree that they are following certain COVID protocols. For example, maintaining 6 feet distance while they're out, or talking to some other people, using mask while going out, hand washing, and so on. So we standardize each indicator and further standardize their sum to obtain the Z score. And for the community behavior, we actually elicited the individual's perception over the community's concern regarding various social distancing measures. And so we use the Z score for the community compliance as well. So these two are basically our main variables. So how did the individual compliance and the community compliance behave in our survey? So if we look here, we will see that in terms of compliance indicator, if we look at maintaining 6 feet distance and wearing mask and using hand sanitizers, we will see that around 55% of the individuals are maintaining 6 feet distance, while wearing face masks is around 82%. Just to say that when we are using these two indicators in our survey, we actually combine these two indicators. That is, in terms of compliance indicators, we are actually combining maintaining 6 feet distance and wearing masks, because these are basically visible compliance actions The other two, that is using hand sanitizers and hand washing, are basically carried out in private domain, for which we really do not have any check or any visible incentive for the individuals to comply. And so far as the community compliance is concerned, we see that out of 10, so basically what we asked to the individual is, out of 10 people in your community, how many stepped out actually for essential purpose? And out of 10 people in your community, how many maintained 6 feet distance while talking? So we will see that out of 10 people, at least 6 people, the individuals think that actually only stepped out for essential purpose, and at least 6 people, around 6 people, are also maintaining 6 feet distance.
Dear presenter, you have 2 minutes left.
Okay, so I'm just going to run through the results quite quickly. So basically the OLS estimates that I'm talking about is basically talks about the perception of the community compliance. So as you will see that in a model where we include only the community compliance, the coefficient remains fairly stable across the specification. We also checked for the potential omitted variable bias using the method of Altenji, Elder, and Tabor, and we found no evidence in favor of such bias. Secondly, what we did a battery of robustness check, where we checked for the compliance protocols in isolation, we checked for the subsamples, we did some falsification test where we replaced the outcome variable with non-equivalent variable, and we really found some insignificant treatment effect. Finally, what we want to present is basically the relationship between deterrence and private compliance. So we actually tried to see whether across lockdown period, there is any kind of differences in compliance, and we see that there is a strong negative relation across lockdown periods in terms of compliance. We also did 2 other things, and that is very important for a policy implication. First is that we did an interaction of the lockdown period with those suffering from the ailment with the community compliance, and we see that when we do the interaction, the community compliance kind of offsets the negative effect of the lockdown period. And secondly, we also see that if we have people suffering from ailment and if they have higher perception about community compliance, their compliance level is actually increasing. So that basically defines our target group. So what is our policy implication? So the policy implication are the following. So the behavioral change, in view of the fact that we find that community compliance could be important, it should target the local community. The target group is basically those who are having higher ailment at home, that is those who have reported cases of blood pressure, blood sugar, and other associated comorbidities. They should be the target group because they respond to the community behavior more positively than other healthy people. Individuals might also underestimate the actual community compliance, and so there is a potential of local communication program that reinforce the positive norms, and mobilizing resources for community-based intervention as opposed to deterrence-based lockdown might be more effective strategy to induce compliant behavior. Thank you.
Thank you. Thank you, Dr. Sakal. I think there's this third paper, which would be presented by Eleanor Wiseman. The topic of the paper is Trade, Corruption, and COVID-19, Evidence from Small-Scale Traders in Kenya. Eleanor is a PhD candidate in Development Economics, University of California, Berkeley, USA. Eleanor, you have the screen.
Great, thank you so much. I hope you can all hear me. I'm going to share my screen. Okay. Well, thank you so much for having me today. I'm excited to be presenting this paper alongside all these amazing papers that we've heard so far. So my paper is actually on East Africa, specifically in Kenya, and it's called Trade, Corruption, and COVID-19, Evidence from Small-Scale Traders in Kenya. So as you all know, to reduce the spread of COVID-19, governments have imposed restrictions since early 2020 around the world. And these restrictions include shelter in place, border closures, product trade bans, and market closures. And in developing countries, these restrictions actually represent a significant shock to the trade industry that relies on these cross-border supply chains, on these movement of goods, and specifically on these marketplaces for transaction where suppliers can meet traders who can meet customers. And this is likely to have spillover effects, such as impacting traders' businesses, but also food availability in the area. So to give you a little bit of context of East Africa, the assessment of trade between African countries is not complete without including informal cross-border trade. And this informal trade is mainly conducted by individual traders or small and medium enterprises. So I'm really thinking in this paper about, these small traders who cross the border using, just by foot or using bicycles or motorcycles. I'm not thinking about these big trucks going across the border. So those small scale traders can either operate domestically, so that, in my context, they buy in Kenya and they sell in Kenya. They can cross the border, so buy in Uganda, sell in Kenya through formal border crossings, pay taxes, and all the bureaucracy that goes with it. But they can also cross the borders through informal routes in order to avoid these official border crossings and avoid taxes. And these cross-border traders are important for the economy. They're an important part of the market chain. They're bringing goods from farmers to consumers. Some are just taking advantage of arbitrage opportunity across the border. But either way, both contribute to employment and food security in the area. So this project is located in Busia, which is a small town really at the border between Uganda and Kenya, as you can see here. And if I zoom in a little bit more, this is what Busia looks like. So you can see it's a town that's spread across the border. The border is just split in the middle with Uganda on the left and Kenya on the right. And if we zoom in even more, you can see that this main road here is where the official border crossing is. That's where the revenue authority agents are collecting taxes and tariffs. But you can also see that there's a lot of routes on either side, on the left and on the right, where traders can cross the border informally, which is what we call informal routes. And the police has, over time learned about these informal routes and are stationed along those to extract bribes when these informal traders are going across. Okay, so the sample population I'm looking at are traders in two industries: agriculture goods, a range of different agriculture goods, including fish, and shoes and clothing. And these traders are located in 30 markets within 40 kilometers radius of the border I showed you on the map. And we're only looking at the Kenya side. So we did a census of all traders in agriculture goods and shoes and clothing in those markets, and we randomly sampled 1,000 traders. So my sample includes now 80% at baseline, 80% of traders trading in agriculture goods, 20% in shoes and clothing. And then we had a mix between domestic traders, so 45%, and 55% of my sample were cross-border traders. So they went to Uganda to buy goods and came back to Kenya to sell them. 80% of my sample is women traders, 20% is men, which is fairly representative of the reality on the ground. A lot of these small-scale cross-border traders are actually women. So this is an example of a trader who's selling, grain. This is probably a medium-sized trader. So COVID hits Kenya on the 12th March of 2020. And from mid-March onwards, there's a range of market closures. Some reopen, some are closed indefinitely. On the 23rd of March, the official border between Uganda and Kenya is closed to people. And when I say closed to people, I also obviously mean closed to these small-scale traders who cross the border via foot. So they cannot cross the border anymore. At the end of March, there's a ban on importing secondhand clothes, which is relevant here, given 20% of my sample is in clothing and shoeing industry. And there's a bunch of restriction until July, where the restrictions start to ease up. And on the 16th of August, the ban on the secondhand clothes is lifted. So what I'm going to show you in the next couple of slides whatever I show you before March is pre-COVID crisis, and after March onwards is after COVID. The data I'm using is survey data that I've been collected across the crisis. I have baseline data from February. That was before we even heard of COVID. It was not even actually. It was initially collected for a project that was not COVID related. So I do have like a pretty a nice kind of clean, pure pre-COVID data. And then every 2 weeks we call these traders to know, how kind of get some data on their trading behavior, and we're creating a panel from February to early August, and the data collection is actually still ongoing. So these are the main results. So first, we actually find a pretty big negative effect on these traders. Specifically, you see like from March to April, there's a 20% drop in, so traders stop trading. 20% is actually pretty big, given that's their main source of income. But we do see that, there's some adaptation, and, these traders are doing better across time, both because they're adapting and also because the restrictions are weakening. In addition to these 20% of traders going out of business, there's also 20% who have to relocate and obviously get spots in markets that are not as good as their initial ones. And that has an effect on their sales and profits. Here I'm showing you profits across time. The blue line is all, red line is women, and green is male. And you can see that, especially if you look first at the one that's combined for all in blue, there's a decrease in sales and profits, specifically between February and March. The sales decreased by 37% and profits by 54%. But what's interesting is we find kind of heterogeneous results. Women's sales and profits are more affected in level, so across every time period they're lower, but also in terms of changes, so they recover not as well. You see men traders are doing better across time, whereas women remain low. And that's despite actually being more likely to stay in business. So we're looking at how these traders are adapting across time. And the main two groups of the sample who are very much affected are, one, traders who are cross-border traders, given they can't cross the border anymore and they can't get to their suppliers, as well as these shoes and clothes traders that can't trade anymore due to the ban. And on the left-hand side, I'm showing you the relation between cross-border traders and domestic traders. And on the right-hand side, I'm showing you shoes and clothing versus agriculture traders. And so as you can see on the left-hand side, these cross-border traders, there's a reduction in the percentage of cross-border traders in my sample across time. So I had 55% cross-border traders at baseline here in February in green, and it's reduced to 10% currently in early August. Similarly, if we look on the right-hand side, in red, you see these shoes and clothing traders. There's a reduction in the percentage of shoes and clothing traders in my sample, specifically when there's a trade ban, and it's recovering now that the trade ban is not there anymore. And the idea here is that these traders that are very affected, cross-border traders and shoes and clothing traders, might be adapting and switching, or they might actually be the ones that are really affected and going out of business. And what we're finding when I'm running here a regression, if I'm looking at column 3 on the probability of being out of business, I'm actually finding that the clothes and shoes traders are more likely to be out of business. So they're actually not adapting and not switching industry, and they're just going out of business. Whereas cross-border traders, despite having their supply chains completely disrupted and they can't cross the border anymore, they're actually really good at adapting and switching to domestic supply chains. So they're actually proportionally less likely to be out of business. So I've told you that cross-border traders are switching to domestic supply chains. Another avenue of adaptation is that trade routes are not fixed. There's actually the traders who continue to cross the border are switching to informal cross-border crossings now. And so what I'm showing you here is in February, if I look at in the red, which is informal border crossings, compared to the blue, which is official border crossing, it's roughly 1.8x. But currently we're at 6x. So there's an increased reliance on informal border crossings compared to formal border crossings. So an increase in informality. And we really see that these traders are switching. When we ask them, have you switched? Have you chosen a different border crossing in the past 2 weeks? 70 to 80% of traders report having to change border crossing and switching to therefore informal border crossings. So I've showed you that what happens in terms of policy and closure of the official border crossing is affecting the use of informality and the use of informal border crossing. I'm going one step further and saying, actually, it also probably affects the cost incurred at the informal sector. And when we're thinking about cost at the informal border crossing, we're thinking about bribes, corruption, harassment. And that's actually what we're finding. So at baseline, 6% of traders report facing corruption. And we're now at 40% of trading reporting facing corruption in early August. Similarly, if we look at harassment, 3% at baseline, with a peak at 30% in early May, and now it seems to be getting better recently. And so the idea here is that the police and the other agents that are known to be stationed at the informal border crossings to collect bribes now can take advantage of the situation. The traders have lost their main outside option of going through the official border crossing, and there's therefore an increased bargaining power for the police who can extract more bribes. And we're finding these results both in terms of incidence of corruption and harassment, but also in terms of level. So there's not only a higher likelihood of facing corruption, when we're actually looking at how much people report paying in terms of bribes, there's an increased level of the bribes being paid at the informal sector, informal border crossing across time.
Dear presenter, you have 2 minutes left.
Great, perfect. And so I guess what I really want to take out of this paper is that it's really important to consider both formal and informal sectors for global health policies. In most developed economies, there's a separation between goods and peoples. So it allows governments to impose restrictions on people's mobility to reduce the spread of the disease without affecting the mobility of goods and trade. So we can close borders to limit people without, but we can say trade vehicles are still allowed to cross the border to limit economic and trade impacts. But in developing countries, that's not as clear-cut. Closing official borders reduces cross-border trade, but doesn't eliminate it, given cross-border traders are still using informal routes. So it doesn't completely limit the spread of the disease. On the other hand, closing official borders to people, but saying trade vehicles are allowed to cross to minimize economic disruptions, is not specifically effective either in areas where trade is conducted by small-scale foot traders. And I think this is the main point I wanted to bring to the table today. Thank you.
Thank you, Eleanor, for your presentation. The final and the fourth presentation would be on the issue of the moral economy of the pandemic in Bangladesh, weak states and strong societies during COVID-19. There are 3 authors for it. Dr. Tariq Umar Ali, Associate Professor, Georgetown University, USA. Dr. Mirza Hassan, Head of the Governance and Politics Cluster, BIGD, BRAC University, Bangladesh. And Dr. Naomi Hussain, Research Professor, the American University, USA. My understanding is Dr. Mirza Hassan is going to present a paper. Dr. Hassan, the screen is yours.
Thank you, Dr. Salim Jahan. Unfortunately, Dr. Mirza Hassan has come down with COVID, and I believe he is in the audience. It's a bit hard to tell because there's lots of people here, but we're all wishing him well. In fact, his whole family has also contracted it, so we're very concerned. But I agreed to step in. I'm afraid it's a bit early and I'm a bit unprepared, so you'll bear with me, I'm hoping, and you'll be kind. But in addition, I should say we feel a bit like outliers because all of these very clever papers with lots of formulae and numbers, and we are a trio of political scientists, political sociologist, and historian. Tariq Ali is in fact a real proper historian, and the three of us did this work earlier in the year because, like everyone else here, I think we felt the need to do something to help out. I should say the paper we're talking about today has already been accepted by World Development, so it will soon be available to view. Are you seeing my screen okay?
Yes.
Great.
You can actually start the slideshow. Yes, that's fine.
Is it,
perfect. Perfect.
Yeah, you can see it now. Great, thank you. So our paper is called The Moral and Political Economy of the Lockdown, and essentially we asked the question, why did the lockdown fail? And I think it's a very good fit with these really very interesting papers that I've been hearing and understanding some of in the last hour or so, because we approach these questions of compliance and stringency, you know, the policy options available to different countries from slightly different perspectives, slightly different, or very different, I should say, disciplinary perspectives. But essentially all of us are trying to answer, I think, the same sorts of questions. What worked? Why did it work? And I'm hoping that our contributions will add. So the question we asked really was, what happened in Bangladesh? Why was it that in April there was an attempt at a lockdown? And at first it seemed everyone was very keen to comply. Everyone was very anxious in April about the pandemic, about the COVID virus. And yet by mid-May, it had all dropped and everyone had kind of quietly perhaps forgotten about it. So we asked, why did this happen? It's not that the virus got any less serious. And we use a combination of theories from political science, political sociology, social history, anthropology, if you like, to explain this. Our research was conducted qualitatively in 2 rounds of research over the phone. We worked actually in a total of 20 sites across the country. These are not intended to be representative in any way, in the sense that in your discipline you speak, but intended to be illustrative, if you like, of the different kinds of communities, the different kinds of social, political, and economic setups, and also of the different varieties of COVID impact that we had seen in April and May. We worked in places, we worked with an excellent research institute called Development Research Initiatives, where they have highly trained and experienced qualitative researchers, mostly trained in anthropology, and we had conducted, they had and we had in other places conducted research in the past in these communities. So we were going into places where we knew people, we had contacts, we knew that we had a sense of the context and of the social, political, and economic dynamics of these locations. So we produced, in fact, these community case studies, an understanding of how the whole system was working at the local level. We interviewed respondents from across the different social groups with an emphasis really on influential people, on key informants who actually had a sense of what is going on at the policy level, at the local administrative level, and you know, in the different groups in society. So these are all done by phone, and here I give you a sense of the 6 different sites that the paper that's going into World Development focuses on. But I should note that we did conduct the research in 20 sites all around the country, and sometimes we talk about the findings from across the country. And I should say, although they're all quite different locations, the findings were consistent really across them, and that is to be expected because Bangladesh is a relatively homogeneous population where people all speak the same language and all have quite similar relationships to the government really. And so the way in which the state performance was judged was quite consistent across these locations. So the context is, and this was the case all around the world as we saw when we looked at the other countries' policy responses to COVID, was the early April lockdown, which was called in Bangladesh the holiday, national holiday. And at least at first, the police and the army were seen as the main enforcers of this lockdown. But we also saw that there was a lot of, the way in which this manifested was a lot of miking. There was some efforts to secure entries to, entry areas to different communities, different villages and urban areas. Local government officials, but also party political actors played quite an important role in policing, encouraging people to stay home, telling them to stay home if they would not. In some cases in providing little bits of relief and so on, giving information. And at first, in the first round of our interviews, we found that the lockdown really had quite a lot of popular support. It had a lot of legitimacy. People were very scared, as I said, about the virus. We heard some things that people, the sense that people are very well informed now in Bangladesh compared to, however many years ago, 10 years ago, 20 years ago. People were keeping a very close eye on the information coming out of the IDC, the national organization responsible for informing the population about the pandemic, and the disease control institute, and people were listening to those broadcasts with great attention. But there was also, of course, a lot of bad information flows as well, because a lot of people use Facebook. But it's very interesting to see that people were able to judge the difference between the good information they were getting from some sources and the rubbish information they were getting from others. But overall, what we found was that people were very nervous, very anxious about the virus, because some people would say things like, well, we've seen how in countries like Canada, they have such good healthcare and they're really struggling. So what's going to happen in a poor country like this with our really weak health systems and so on? And of course, people were right to be concerned. So we thought people were quite well informed, and they complied because they agreed with the government that this was important. In fact, many people said it should have happened earlier. The lockdown should have happened earlier, and they should have quarantined people coming into the country, which I think the policy experts would say that would have been the right thing to do, but it didn't quite happen in that way. But already in April, people were telling us that yes, we can lock down. We'll stay at home. We won't go out and do our business. We won't go to work and so on, if we get relief. And this was very interesting, is that nobody expected really that poor people would be able to stay home. From the very beginning, everybody said, like, if people are not, unless the government is going around house to house delivering food, we cannot expect people will stay home for long. So at first, in this early phase, people had savings, they could draw on that. This started to wind down. We heard a lot in this early phase about the relief that was going to come. There were announcements about this enormous package of relief that was going to come. And people were hoping that this was going to alleviate, because they could not, they were very fearful about going out and continuing as normal. But already by mid-May, we see, and I should say a little bit of background to social protection measures in Bangladesh, and I think this is certainly true of India and other parts of the developing world, Kenya as well, a country I know reasonably well. The assumptions of corruption, mistargeting, and so on in welfare provision, in social protection, are very, very common. People believe this widely, that the local officials or somewhere along the system, money will get lost, or cash or food or whatever it is will be misallocated, will be stolen. And they believed this also in Bangladesh, but there was a great hope that this would not be the case. But by mid-May, we see that most people don't feel that the relief is adequate. They feel it's too little, it's very unreliable. Some people are fearful that it's only going to people who are well connected. And I should say that our research does not have any objective findings about this. We do not know, in fact, what happened to the relief. In fact, we think it's highly unlikely that a great deal of relief was lost to corruption. But we do think it's very clear that people did not trust the regime. They did not trust how it was being distributed. They did not trust that it would be going to the right people. And that had a lot to do with the lack of transparency, the lack of accountability in the system overall, which is overall generally geared towards rewarding political supporters, but it is not a highly corrupt system so far as we know in general. So after only about 6 weeks of the holiday and the lockdown, it was quietly withdrawn. It stopped, the miking stopped, the policing stopped, the army stopped coming out to push people back into their homes. the closures of the shops and so on. Shops were reopened and so on. And we give this quote because we think this gives a very, very good flavor, very good illustration of how the population was feeling and how the state was responding, government responding. And this is the quotation from somebody who said that they observed this encounter where the police beat up somebody who was out on the street, and this man said, look, I have to come out because I have to earn enough to feed my family. And so the police had no answer. What are they going to say? So you have to stay inside and starve inside? No, of course you can't. So there was a sense in which the people who were policing, the army, the police, the local government officials, even the political party actors, had a sense of forgiveness. They had to recognize, they had to realize that as the relief was so inadequate and people could not rely on it, that there was no way in which they could force people to comply. And we found this across the settings. There was a sense, and this is, middle-class people who could afford to stay at home, were themselves understanding, even though they were fearful, they were understanding of those people who would need to leave the house. So even before the official announcement that the lockdown or the national holiday was over, people were already being forgiven for going out. The police were unable to force the lockdown, and people were starting to go out in a large way. So I'm going to end quite soon. I just wanted to talk to you a little bit about the theories that we're drawing on to help understand this situation. So, a big theme, particularly early on in the pandemic, was this argument about regime type. Is it democracies, is it authoritarian regimes? Which ones will do better at managing the pandemic? And the answer, the evidence appears to be that regime type does not matter in any simple way. Some authoritarian regimes have done very well, others have done very poorly. Some populist regimes have done relatively well, and others have done, and I live in the US, by the way, others have done very poorly. And so regime type does matter, but how it matters is not entirely clear. We drew on the concept of state capacity, and we looked at three particular aspects of state capacity: how much power it had to coerce the population, how much power it had to police its own political actors and make them enforce their policies, and also what it had to do in order to preserve its own legitimacy with the population.
Dear Presenter, you have 2 minutes left.
Thank you, I'm just about done. We drew on Joel Migdal's work on weak states and strong societies, and Bangladesh has frequently been seen as a weak state in a strong society, and I think this remains true even though the last 10 years has seen a dramatic strengthening of state capacities in Bangladesh, both in terms of resources, in terms of personnel, but also in terms of political authority with the population. Although no free and fair elections have been won for some years now in Bangladesh, nevertheless, the party of government enjoys a high degree of legitimacy and popular trust, mainly because of delivering economic and social rights. So we drew on Joel Migdal, Michael Mann, who writes about infrastructural power and the power of the state to get its policies passed. And then we were, in the review process, we had this novel experience of getting very useful reviews for a journal article. And one of the reviewers suggested we read Alicia Holland's work on forbearance, which theorizes that sometimes when policies fail, it's not because the state is incapable, because of a deliberate policy choice. And I think this is what happened in Bangladesh was, we think this is what happened in Bangladesh was a deliberate choice to not enforce its policies because of the damage that would do to the state's legitimacy with the population, because the state was unable to deliver the relief that people needed. And so we also drew on Margaret Levy's work on contingent compliance, which said that people were compliant to the extent that relief was being delivered. It was contingent on that compliance. And finally, we also draw on the social historian E.P. Thompson's idea of the moral economy, which we all think has been quite important in the political culture of Bangladesh in determining the relationship between the citizens and the state. Moral economy is the idea that in times of crisis, the public authorities have a responsibility to protect citizens against subsistence crisis. And this was a case in which the only way they could do that was by forbearing from enforcing lockdown policies. And so this paper, oh, do I have more? Sorry, there's one more slide. I didn't realize that. This just reinforces what I've just been saying. This paper will be available in the next week or so, I think, online. So please look out for that, and we look forward to hearing your comments. Thank you very much for allowing us to be part of your otherwise fully economics session. I hope we haven't disturbed your disciplinary purity too much. Thank you.
Okay, thank you, Dr. Hussain. I think it was a very interesting paper and a kind of brought some fresh air in terms of listening and as well as in terms of the focus of it. We have a designated discussant for this session, and that's Professor Selim Raihan. So Dr. Raihan, you have the screen now to provide your comments. After you finish, then I would also urge all the presenters to look at your chat box. I can see that there are 21 comments or observations there. So look at it. After Dr. Raihan finishes, we will go back to you one by one and would request you to respond to some of the questions or the issues that have been raised by different people in the chat box. Professor Raihan, you have this screen.
Thank you, sir. I think I must congratulate 4 presenters for presenting excellent papers and very relevant. I thought that especially this session has 4 interesting papers and all emphasis on the lockdown and its economic effects and institutional challenges. So I thought 3 important questions are relevant for this session. First, how effectively countries impose lockdown? What are the differences in country experiences? And do you observe any pattern? Does quality of institutions matter? So this is my first question. Second is, it was a popular phrase we heard quite a lot, that the choice between life and livelihood. But is it a choice at all? During the lockdown, how did state respond to protect lives and ensure livelihood of the population? And the third question is, how stringent were the stringent measures, actually, if I call them stringent, how do we take into account state capacity, people's awareness, people's compliance to so-called stringent measures, and the state-citizen relationship in answering this question? So with this, I'd like to say a few words about 4 papers. The first paper on pandemic catch-22, how effective are mobility restrictions in halting the spread of COVID-19 by Adnan Fakir and Tushar Bharti. The paper looks at the factors contributing to their effectiveness of mobility restriction. I find it very, very interesting paper. Very neat econometric specification and exercise. The paper finds interesting results while looking at effect of restriction on mobility versus contagion. So first, one of the results is that restriction curve mobility better in developing countries. But my question is that, is it really the case? We just saw the Kenyan paper where by Elenier, who provides a different insights when you take into account the informality. So I think I'll also talk a little bit about this when I'll have my opinion on that particular paper. But I think this is a question whether restriction actually could curb mobility better in developing countries. And then your second point, I think this is something I also accept, that restrictions contain the contagion better in developed countries. So I think because of the reasons you have already mentioned. The authors argue that decrease in mobility due to stricter restrictions had a larger effect in controlling the contagion in more developed countries. So we heard that. The authors try to infer why not in developing countries and offer a range of possible reasons. That's what you showed in the slide. But my question is, can you draw these lessons or reasons from your regression analysis? Or you just try to add these reasons to your the regression or the results you have found from your regression analysis? So how would you like to modify econometric model if data is available? I think subject to the availability of data. I know the kind of data you've used. So if data is available, to take into account these factors. So these are my comments for the first paper. The second paper, I think it's also very, very interesting. Lockdown, community abidance, and individual compliance, evidence from India. The paper models private compliance in a setting of interdependence of individual health and community compliance and shows that even after controlling for individual health and income, private compliance might move in the same direction with community compliance. Very interesting, I found. I have just few observations, probably just for clarification. I think the authors can clarify. The paper uses online survey data of 934 respondents across India between April and May this year, and mainly through snowball sampling. So I have a question on this sampling. Do you think alternative sampling method could be used instead of the snowball sampling? If not, what were the problem? I know you talked about the possible indigeneity issues in your paper, but can you elaborate a bit for the general audience? Also, in the regression, how does community level characteristics affect the behavior? For example, the characteristics of the community where the household is located. You took into account the household level characteristics and individual level characteristics, but whether that's possible to take into account, if possible, the community level, because you are talking about the community compliance as well. But my more important question is that you took respondents from West Bengal, Tamil Nadu, and Northern India, and we all know that these states have different measures and different socio-political context. So can you elaborate on this? I know you used the state dummy, but whether it was enough to actually take into account, or when you explain the results, can you elaborate on this further? The third paper on trade, corruption, and COVID-19 evidence from small-scale traders in India, a very interesting analysis on how informality matters in developing countries when you look at the effect of lockdown on trade and economy. So very interesting to see the flexibility of informal traders to adapt to the situation, which many formal traders may find difficult. I have a query on your slide 17, if I'm not wrong, where you showed the dependency of equilibrium cost across formal and informal routes, but actually you talk about the corruption practices. And you showed that the corruption practice actually increased. But I was a bit curious about the number of observation, because I saw that it declined quite significantly over time. Why is that? Also, how did the informal payments affect informal trade? As we are talking about a very abnormal time and also suspension of supply of essential goods and services, probably people were ready to pay higher prices. So do you see any kind of effect on the prices because of these informal payments? And now my very final comments, a set of comments for the final paper. Very interesting political economy analysis, the paper on why did the lockdown fail, the moral and political economy of COVID-19 in Bangladesh. No, we don't consider you as outsiders. We consider you as part of us because it's a broader political economy analysis. And I think it was a very, very good and excellent contribution to this this session. So very interesting political economy analysis of lockdown and pandemic management in the context of Bangladesh. I have a couple of few queries. First, you mentioned about the survey. So I think in the presentation, I don't know whether you did it in the paper, but probably in the presentation, some summary of results from the survey could be presented. Also, you have asked the question in your presentation, efficient management of the pandemic, does regime type matter? And you try to elaborate on this. But do you have any counterfactual or any comparative analysis to answer this question? Because you tried to answer this question in the context of Bangladesh. I thought that probably the answers are more on a kind of theoretical or analytical perspective rather than providing any kind of evidence-based. So, and my final point is also related to that. Some more evidence-based analysis is required when you say that Bangladesh state has been weak vis-a-vis society. So with this, I'd like to stop here, and I wish the presenters, I think it's an excellent set of presentations, and I'm quite sure that the participants will also have a number of observations which will also, feel important to answer. Over to you, Honorable Chair.
Thank you, Professor Raihan. We have some time to go into discussion. Actually, we have around 45 minutes, I think. I'll just take 5 minutes at the end of the session just to make some overall comments. We can have more than one round of discussion. So what I would request the presenters, A, to be precise and to the point, of course, and B, if you can cluster some of the questions rather than answering individual questions, we will save time, as well as it would be more effective in terms of presentation, as well as the discussion that would pursue. So with that, I'll go to the same kind of order that we have started in terms of presentation. I'll go to Adnan to look at the questions that are directed at him and his co-author, of course, and to make some comments. And this should be actually 2 to 3 minutes, not more than that. Let's do the first round first. Adnan.
Thank you, Salim Bhai. Salim Bhai, thank you for your valuable feedback. And you're absolutely right in pointing out that what happened to mobility, right? So one of the things that I did not present, it just kept it in the appendix, is if you look at the summary statistics, mobility did fall much lower in developing countries. And in developed countries, mobility fell actually much larger, much greater. So the effect that we see is basically just the marginal effect. But if you take the level effect at the mean, then developed countries still end up having a larger effect. We should have been clear about that in the paper. I should have mentioned that more clearly. So even though we see a larger marginal effect, when we compare it to the mean, developed countries still have the larger level effect. So that's the one thing that I wanted to quickly share and point out. In regards to the second point, in terms of the reasons provided, that's the thing that we're working on right now, trying to figure out what type of data can we incorporate to address some of these findings of the other papers and whether we can corroborate with that or not. The one that we're working on right now is in terms of whether flattening the curve was actually marginally useful or not in developing countries versus developed. We're still on the process of figuring that out, but hopefully we'll add that to the working paper when it's done. But thank you for the feedback. That was really important. Quickly over to the comment section, there were 2 comments that I'll quickly address. The first one was, and I'll read this out. The first question was in terms of, do we see early peaks for countries with higher vulnerable population, high democratic values and institutions, temperature, climate, and having more informality in the light of lockdown? One thing we do see is that when we are looking at the flattening of the curve, that countries with with better democracy and better government effectiveness were more effective in terms of flattening the curve, in the sense that from the day of the first case, their peaks on average came much later and they were much lower. So that's the aspect of that. We haven't done that analysis per vulnerable populations, though. That's a completely different analysis and would require a lot more effort into that. The second question related to that is, what about the impact of the sub measures of stringency in terms of workplace closing, staying at home, traffic restrictions, and so on? And what's the differential impact of those sub-indexes on the COVID cases and mobility? So when we break down the stringency index according to the stringency index basically uses 9 factors to build it. So when we break down the index to its individual attributes, we see that workplace closures, school closures, and domestic and international travel restrictions have the strongest effect on both mobility and growth rate of COVID cases, respectively. What we did not find a strong impact of, and that all goes back to Dr. Prasenjit's presentation as well as Dr. Naomi's presentation, public information campaigns did not have a significant effect. And that's something that we found very surprising, at least on average. Thank you. That's, I think, all the questions directed at me. Thank you so much.
Thank you, Adnan, for your intervention. It was good and brief. So with that, I would go to Prasenjit now. Prasenjit, you have the screen.
Yeah, thank you, Professor Raihan, for very good comments. So the first one is on snowball sampling. Yes, we realize that, that could induce some amount of bias in the estimates, but we tried all possible avenues in order to see whether the variations are okay with the estimates that we are dealing with. We did all kind of robustness checks with our estimates as well. I think this answer is also tied to the kind of consistency checks that we had been offering. So I would tie down 2 questions here. One is from Shubhajit Banerjee, who actually asked whether we have accounted for the media effects in our estimation or not, and about the omitted variable bias test that we have incorporated in our paper. So you see, one of the major problems in this kind of analysis is that when you do when you base your narrative on the heuristic of coefficient stability, that you go on explaining that your coefficient remains stable across different specifications, even without incorporating the control. And when you incorporate the controls, you see your coefficient sign remains fairly stable. You still do not account for the variables that might be omitted from the equation. One of such is basically the media effects that might be there, which might be kind of influencing both community as well as individual compliance. So what we did is we used a test from Alton G and Oster, Alton G in 2005, which was kind of theorized by Oster in 2016, where they said that the selection on observables is actually proportionally related to the selection on unobservable. So we actually did a test on that, and we found that, and these are actually related to the basically in estimating the full set of regressions with observables and unobservables, calculating the R square, and then doing the restricted set of regression by incorporating only the observables and calculating the R square. And from there, we find, and Oster actually proposed across different simulations carried out in from many RCT studies, that the relation between them should be 1.3. Now, if the coefficient of proportionality is adjusted such that this 1.3 can be exceeded without beta, that is the coefficient of interest, being turned to 0, the details are there in our paper, you can say for sure that there is no omitted variable bias. We have seen that if
Prashanjit, we can't hear you.
Yeah.
Prashanjit, we can't hear you. No, I think we can't hear you. Can everyone hear Prashanjit?
I can't hear Prasenjit, no.
No, no. So maybe
maybe we can go to Illinois,
yes,
and then
yes,
in the meantime, Prasenjit can take care of the technological glitches. Illinois, are you there?
Yes, can you hear me?
Yes, we can hear you. So please go ahead.
Okay, so I'll try and answer the question. So there was a comment about slide 17, and you're seeing numbers reducing across time, especially for the incidence of corruption and harassment. This is due to, so these questions are targeted to cross-border traders. And as I mentioned, a lot of cross-border traders are switching to domestic. So across time, there's fewer and fewer people who are crossing the border. So that's why the number are decreasing across time. There was a question about how does informal payments affect informal trade? So I kind of see that as an equilibrium. So it's a kind of a new equilibrium. We have traders who are switching from, formal cross-border trading to informal trade. And that obviously, means that the police at the informal crossings have a higher bargaining power and can extract more. So they kind of go hand in hand. If the question is specifically, does informal payment really affect informal trade in that direction? I think that, it does. I think that we've seen that informal payments go up. We've also seen that some informal traders are switching to domestic traders or are going out of business. So I think there is, a relative cost and benefit. If it's too expensive to cross the border the informal way, then I may, try and look at if there's better routes domestically, or I may have to go out of business if my budget constraints is binding. So I think for sure, there is an increase in prices, which has consequences for other segments of the population. The last question was, we're talking about an abnormal time. Are people ready to pay more for these goods? I think it's a great question. And the big next step of this project is looking at prices. We've collected price data across markets. And the next step is trying to see how that affects. And my big idea, what I'm hoping to do is trying to see whether price fluctuation depends on how whether the industry relies on informal or more formal or more informal, I guess, trade, because we should see variation in those. And then to finish, just a quick answer on the comment I had on the chat. Yes, there is. So we do see women are more likely to be affected for sales and profits, but less likely to be out of business. The reason why they're less likely to be out of business is because men are actually more likely to be in shoes and clothing and in domestic traders. So they're just in the groups that are more affected. So there isn't a true gender gap here, it's just correlations. Whereas sales and profits, even if you control for industry and you control for other aspects, there is this gender gap that remains for sales and profits. Thank you.
Thank
Sir,
you.
Prosenjit is back and we think his microphone is working. Would you
Okay,
allow him?
let's go with Prosenjit then. Prosenjit.
Prosenjit, you have to unmute your microphone. Yes. No, I think it's not working.
It's not?
Can you hear Prosenjit?
No, I can't hear Prosenjit.
So Prosenjit, your microphone is not working at all for some reason.
So let's go to Naomi
yes,
then.
Sure,
Yeah.
sure, of course.
Okay, as we go to Naomi, I would also request all the presenters to check the chat box one more time. There may be new and more recent comments and the questions. So Naomi, you have the floor.
Thank you so much. I don't know if Dr. Mirza Hassan or Dr. Tariq Ali would like to also add any comments. Thank you, Dr. Salim Rahan, for your always very good comments. If we did mention a survey, I don't think we mean in particular a survey in the sense that you mean like a sample survey, but a study that covers, you know, a wide-ranging population. So it's not, we wouldn't have the kinds of results that you would be expecting. We couldn't present them in a table with t-tests and so on. But there was a survey. There is a survey that has been taking place, you know, in parallel. The BRAC Institute for Governance Development have been doing with the Hussein Zillur Rahman's organization PPRC. So there are some survey results that are quantitative and, you know, representative to the extent that is possible. Our findings are presented as community case studies. So we have small write-ups for each location, each of the research sites. So very good questions. But I think actually you raise a very interesting point, which is that we could probably have tested some of these ideas quantitatively. I think the time now has probably passed, but we could have done. You also asked about the efficient management of the pandemic and whether regime type does matter or not. And I think the evidence seems to be from Bangladesh and from elsewhere that several factors matter together. So it's not just whether it's an authoritarian or a democratic regime that matters. It is the nature of the state-citizen relationship. And that in turn depends on at least two factors. One is trust. So the extent to which citizens trust what the state, what the government is saying, what the government is requiring them to do, and also trust that the associated policies, the supportive policies, particularly around social protection, will be there. And that also depends a great deal on political history. What people trust governments when they have reason to trust them, when they have a history of doing what they say they're going to do, of being there when they need to be there for their citizens. So that's very important. There's also an important issue of freedom of information. In countries where information flows are very tightly regulated by governments, where there's a clampdown on, for instance, social media, in particular on the print media. That will also reduce trust, as we have seen in many countries. But the other aspect that really matters is state capacity, as we've said. Can the state afford to do the things it claims it's going to do? Does it have the resources to do those things? And is it able to make its officials do as it wants it to do? So it's all very well for the Prime Minister or the President or whoever saying, we are going to do this kind of lockdown, we are going to give this kind of relief. But if they cannot enforce that with their own people, with their own administrative machinery, then that's an issue. So these two things, I think, trust and state capacity. Perhaps Dr. Mirza Hassan has the energy to respond, or Tariq Ali, anyone from our side? Thank you very much for very good comments. And as I say, paper will be out probably next week, so keep an eye out on World Development.
Thank you very much.
Can I come in for a second? This is Dr. Mirza Hassan.
Oh, please.
Sure.
Sure.
About the question, Salim's question on the regime type comparative understanding, we didn't reflect on the literature, but personally, I've gone through the literature, mostly qualitative in nature. There's a debate going on, led by famous scholars like Fukuyama and other people. And the consensus is that there is no easy connection between regime type and the performance in terms of COVID management. But all, as Naomi Hussein, elaborated it right now. So you have to look at the social mechanisms, the connections between the questions of, the regime type and the policy. So, we talked about contingent compliance, we talked about forbearance. These are the social mechanisms that connect the variables, what kind of result can be expected. So the result is very mixed, and you have to look for that. You can praise authoritarian countries, Vietnam, China, Singapore, and so on, for fantastic COVID management. At the same time, you can praise Kerala, democratic, New Zealand, and so on, South Korea, and so on. So looking for that holy grail, the connection between democracy or regime type and COVID management would be a futile exercise. Rather, that we wanted to do, and we reflected on Bangladesh, saying that we have to focus on the social mechanisms, and those mechanisms are manifested in the state capacity and so on. Thank you.
Thank you very much. I think that was a good addition to the discussion that we are having. Any of the paper presenters have anything that they want to say, any burning issue that they forget to mention, or some of the questions that have been raised in the chat box that have not been answered? Anyone can chip in?
Sir, Prashinjit, I think he's giving his last try.
Okay.
So, but he has logged in through another device. So Prashinjit.
Okay. Let's see.
Yeah, so thank you. I don't,
yes.
Yeah. So I would just like to respond to two other very important points that Professor Raihan had raised. One is regarding whether we have adequately, am I audible now, I guess?
Yes, you are.
Yeah. So two of the important issues that Professor Raihan had raised, one is that whether we have adequately controlled apart from the state dummies. The answer is yes, because we did some subsample test. One is basically we did it separately for West Bengal and Tamil Nadu, and the second we did it at the level of metro cities by incorporating city fixed effects. So even after incorporating for city fixed effects, we found that our effects remain fairly stable over time. The second thing is that yes, about causality we were very careful. So as I said, that one test is obviously the omitted variable bias test. That is one of the participants have also referred whether we have captured the media effects or not. So like this, there are several variables which might be affecting both CBAR and CIE at the same time, community and individual compliance. So what we did is, as I was trying to explain, we did control for them for the omitted variable bias test. It is almost like doing the method that we used is by Altenji and Oster. So it is almost like doing a controlled and an unrestricted regression, almost similar like what we do in simpler F tests. But here the logic is this, that if we do one regression with the control variable and if we do one full regression, then we get two different R squares. Oster actually simulated the relationship and found that if there are proportional relationship between the selection between observables and selection on unobservable, if they are proportionally related, then the relation between these two R squares will be 1.3. And then he argued that if this proportional relationship ranges between -1 to +1, given R 1.3, then you should see whether for different values of R square, your beta, that is the treatment variable, changes sign or not, or whether it becomes insignificant at 0 or not. So we tested even for the higher coefficients. So we assumed even higher proportional relationship between unrestricted and restricted R square, but still we saw that even at the even though we did snowball sampling, even though these are kind of some kind of non-random nature of a sample, we saw that our estimates actually passed the omitted variable bias test. But we actually could not control for the reverse causality kind of thing, but because that is one thing that we actually did not find good instruments for. But the others we actually control for, and one important limitation of our paper is basically the nature of the data, which follows because we have to conduct this survey during the lockdown period, and we did not have any other instrument. Whatever we had in hand, we actually did that, including the CT fixed effects and the omitted variable bias test. That's all I would like to say. Thank you.
Thank you, Prasenjit. You can trust the state, but you cannot trust the technology. It seems sometimes it doesn't work.
Absolutely,
anyway,
absolutely, sir.
Anyway, any other comment from anyone, or any of the presenter wants to pose a question to the co-presenter? Yes, no? No, I think everybody is satisfied. So, Salim, can I just bring it to a closure?
Sir, it's up to you, sir, please.
Okay, good. I think let me make 3 observations and then 3 comments. The first one is that I'd like to congratulate each and every presenter. I think the papers have been quite substantive, very insightful. They have brought in new questions, new issues, and I personally, and I'm pretty sure those who are watching it, have enjoyed the presentations immensely. So that's first. Second, I think all the papers that were presented, there is an academic interest, of course. Everybody pursued their papers or line of thinking because of their academic interest, but all the papers also have policy implications. If we look at the papers and look at some of the issues that the presenters have raised, I hope that they would also knock on the doors of the policymakers, and they will try to, apart from the maths and the econometrics, they will try to find out some of the basic issues that the presenters have presented in their paper. And it would be part of the policy discourse at the state level, at the government level. And of course, some of the issues would also be part of the public advocacy. There's no doubt about it. The third is that everyone has said that all the papers are almost papers in progress. And I'm pretty sure that on the comments that have been made and some of the issues that have been raised, all the papers would be finalized, if I may use that word, using some of the comments, some of the suggestions, some of the observations that people have made. Having done that, the 3 observations, let me come back to the 3 comments that I have. One, even though the papers have covered different areas, focused on different issues, there is a similarity and interconnectedness among the papers. I mean, on one hand, one of the papers is on developing countries in general, and then there are 3 kind of country studies: India, Kenya, and Bangladesh. So they are very complementary to each other. The second also, I think the paper by Adnan and the paper by Prasenjit are very much complementary, because Adnan's paper actually concentrates more on restrictions, and he comes to the conclusions that restrictions is not a sufficient condition to deal with this issue in the developing countries. Prasenjit's paper, on the other hand, talks about the moral persuasion kind of thing. And there the action by an individual is very much determined by what the communities do. So it's not a question of either or, it may be complementary, but I think they have brought 2 different perspectives into the whole discussion. Third, I think Naomi and Mirza Hassan's et al.'s paper, that's a very good paper, bringing in the institutional factors. We talked about economic impacts, we talked about mobility, we talked about other issues more related to economics, but the whole institutional issue, and the institutions of course matter, but this is also a complex issue. So I think that paper is not only a breath of fresh air, but it is very much complementary to the kind of the economic issues that have been raised on different issues by other presenters. So in a way, I see all the papers very much fit into each other in a cluster, where we talk about the economic impacts as well as institutional changes. So that's my first comment. The second comment is, I think some of the researchers would also pursue in coming days or coming months on one important issue, which is very much on my mind. And what I think that as COVID-19 progresses with its economic impacts, with its social impacts, there would be new generation of poor, and there would be inequalities coming in. Because the very nature of the problem and the way we are responding and the way we are situated right now in terms of different groups, rich and poor, rural and urban locations, ethnic minorities, and so on and so forth, the way the COVID is advancing and the way we are responding to it, there would be definitely more poverty or new groups of poverty, as well as inequality. So this is one area as social scientists, I think we also have to focus on it. One simple thing, I mean, there is online schooling everywhere. Now we are talking about whether in developing country or in a developed country, but the whole question of access to online school would very much depend on the kind of the social and economic condition of the families. So this would also have an impact on the kind of asymmetric learning by different groups of children. So this is one thing that I just raised so that some of the social scientists, some of the presenters, researchers can take into account, whether at a country level or at a more regional level, to deal with this issue. Thirdly, I think it has come out from different presentations. One is that since this is a global pandemic, it would need global response. Definitely, there will be national policies, there will be regional approaches, but if the world doesn't come together in responding to it, I think we will not be able to overcome some of the challenges that we have talked about right now. Even in the case of vaccination, I mean, basically in the absence of vaccination, we have talked about different approaches under non-pharmaceutical initiatives. But even in terms of the vaccination, I think it would need a global approach to that. The second point is that we have raised that very important issue in Naomi and Mirza Hassan's et al.'s paper, the type of the regime which is best suited or better suited to deal with those issues. Definitely, without talking about different issues, we know that the issue of transparency, the issue of accountability, the issue of trust, as Naomi has pointed out, would be very much needed in dealing with this kind of pandemic. It's not only an economic issue, it's not only a public health issue, it is an issue of political economy. So unless we address those issues, it will not be possible on our part to deal with this issue. And my last point regarding this is a new phenomenon. It is still not known to any groups of experts, whether it's the public health experts, whether it is medical experts, whether it is social scientists. We are learning every day. So therefore, I think when we think about how we approach it, how we deal with it, we also have to think out of the box, because we cannot deal with these problems of today and the challenges of tomorrow with the instruments of yesterday and the institutions of yesterday. So I think this is something that we have to think about. But once again, I would like to congratulate all the presenters as well as SANEM for organizing this particular session and the conference. And my personal gratitude and my personal felicitation goes to Selim, Dr. Selim Raihan, who has been spearheading this organization and coming up with the brilliant ideas of having this kind of conferences. So thank you very much, Selim.
Thank you, sir. And I also take this opportunity to thank all the paper presenters and the participants. I think it was an excellent session, and I actually personally learned a lot from these 4 presentations while I read and some of the papers as well as the presentations. So thank you, and I welcome you again for the next session, which will start at 7:30 Bangladesh time, 7:30 p.m. And we have 3 more sessions tomorrow. So thank you so much. And with this, I would like to close this session. Thank you, sir.
Thank you.
Thank you.